Can you talk about children when it comes to this, and then expand? Because, Gabor, a few weeks ago we were talking about addictions, and that's both heroin addiction, but expanding it to other addictions as well, and the role of childhood. And in doing this, though you talked about it before, talk about your own.
Well, again, in the book, When the Body Says No, I give the example of my visiting my mother one day in a nursing home. Now, my mother had muscular dystrophy, which is a degenerative disease of the muscles, hereditary, runs in our family. And so she could no longer walk, get out of bed, even feed herself very well. So she was in a nursing home, mentally completely with it, and emotionally very strong. So I'm walking down the hall of the nursing home that day, and I'm limping a little bit. And why am I limping? Because that morning I had arthroscopic surgery on my knee, which I had to have because I tore a cartilage in my knee jogging on cement. So I have a little bit of a limp that afternoon. When I get to my mother's room, I suppress the limp. The limp disappears. I walk to her bed nonchalantly, greet her, we have a lovely visit. I walk out of the room with a perfectly normal gait, and when I shut the door behind me, my limp begins again. And only later on did I think, what am I doing here? It wasn't conscious. I didn't do it deliberately. Of course, clearly I was trying to protect my mom from the awareness of my pain. Now, my mother at age 78 did not need to be protected from the fact that her middle-aged son had a bit of a limp the day of surgery. It was a childhood ingrained mechanism, going back again to my first year of life in the ghetto of Budapest, when, as I mentioned in my first visit to your program, we lived under Nazi occupation, a Jewish family. My father was away in forced labor. My mother was a highly stressed woman, trying to do her best to ensure my and her survival, which she was barely able to do. I learned as an infant to suppress my pain, to protect her from it, because she already had too much, in order to protect my relationship with her. Now, those emotional patterns are ingrained in children from early on, and although I have no recollection of that time in my life, the memory of it lives in my cells and lives in my brain and shows up in my interactions with people, including in that example of trying to protect my mother. So the point is that human beings are shaped very early by what happens to them in life. As a matter of fact, they're shaped already by what happens in uterus. After 9/11, after the World Trade disasters in those terrorist attacks, some women who were pregnant suffered PTSD, post-traumatic stress disorder. And depending on what stage of pregnancy they suffered the PTSD, when they measured their children's cortisol levels, cortisol being the body's stress hormone, at 1 year of age, those kids had abnormal cortisol levels. In other words, their stress apparatus had been negatively affected by the mother's stress during pregnancy. Similarly, for example, when they looked at the stress hormone levels of the children of Holocaust survivors with PTSD, the greater the degree of PTSD of the parent, the higher the stress hormone level of the child. So how we see the world, whether the world is a hostile or friendly place, whether we have to always do for ourselves and look after others, or whether we can actually expect and receive help from the world, whether or not the world is hostile or friendly, and indeed our stress physiology is very much shaped by those early experiences, and that's then what we act out much of our lives, and that's then what interferes and affects our health later on. The implication of this, Amy, for treatment is that when somebody comes in with a first episode of rheumatoid arthritis or multiple sclerosis, or even a diagnosis of cancer, it's not enough to give them pills. It's not enough to give them radiation or offer them surgery. They should also be talked to and invited to and encouraged to investigate how they live their lives and how they stress themselves. Because I can tell you from personal experience and observation that people who do that, who take a broader approach to their own health, they actually do a lot better. And I know people who survived supposedly terminal diagnoses simply because they've taken their own mind-body unity, and I would say spiritual unity as well, seriously, and they've gone beyond the narrow medical model of treatment. And I'm not here to disparage the value of the medical approach in which I was trained. I'm just saying that it's hopelessly narrow, and it leaves many people without appropriate treatment and appropriate support.
Dr. Gabor Maté, you talk about adverse childhood stresses as ACEs.
Yes, there was a
And their
Yes,
connection also to addiction, this latest book that you have written, In the Realm of Hungry Ghosts.
There was a number of large-scale studies in the United States done by very brilliant researchers called the ACE studies, ACE, Adverse Childhood Experiences. An adverse childhood experience is a child being abused, or violence in the family, or a parent being jailed, or extreme stress of poverty, or a rancorous divorce, a parent being addicted, alcoholic, and so on. When it comes to addiction, these effects are additive, so that if a child has a number of these adverse childhood experiences, his chance of becoming a drug addict later on, or any kind of an addict, go up exponentially. So a male child with 6 such adverse childhood experiences has a 4,600% increase in the risk of him becoming an injection-using substance addict than a male child with no such experiences. In other words, a 46-fold increase in the risk. And interestingly enough, those adverse childhood experiences also exponentially increase the risk of cancer and high blood pressure and heart disease and a whole range of other diseases, as well as suicide, of course, and early death. In other words, there's a real connection between early childhood adversity and how a person lives their lives and the later appearance of addiction and diseases, physical and, of course, mental illnesses at the same time. And if we don't take this into account in medicine, most of the time people are not asked about these things in doctors' offices, and they're not explored, they're not encouraged to explore their childhoods and the kind of impact that the childhood has on their adult behaviors.
As